Klinefelter syndrome is a condition where there is one extra X chromosome on the human male chromosome, making it XXY. Klinefelters is due to non-disjunction during meiosis I, where a homologous chromosome fails to separate, which produces a sperm with an X and Y chromosome. Then, during fertilization with the X egg from the mother, it causes XXY.
This syndrome occurs once every 500 live male births. A variation of this is XXYY or XXXY. This occurs 1 in 18,000 to 50,000 male births. Another variation is XXXXY. This is found every 85,000 to 100,000 male births, although the last two variations are very rare. Klinefelters can also be found in cats. Characteristics can vary widely from no signs to many, which is why the only really reliable method of finding out if you have it is by karyotype testing. Typically, male babies with this disorder have weaker muscles and reduced strength. XXY males tend to go through a shorter period, and during puberty they do not produce as much testosterone, have a less muscular body, grow less body hair, and tend to have larger breasts. In adulthood, they can look similar to normal males but have a lanky diaphragm. Sometimes with gynecomastasia, or increased breast tissue, small testicles are often infertile.
A treatment that many Klinefelter males get is androgen therapy. This is started during puberty or when one finds out they have this syndrome. Testosterone replacements are started and the dose is increased until there's enough to maintain appropriate levels of hormones like testosterone, follicle-stimulating hormone, and luteinizing hormone. Here's the story of Dan, a 33-year-old that was diagnosed with Klinefelter syndrome 2 years ago, who shares his experience and stories with us.
I'm 33 at the moment. I was diagnosed with it when I was 31 after myself and my partner were trying for children for about a year and a half. So in my case, they did a chromosomal analysis to make sure that everything was fine on a genetic level, and this is where they discovered Klinefelter syndrome, aka 47XXY. When I was told, it was a massive shock because, you know, one of the big things are that you are infertile, so you can't have children, your body doesn't produce sperm. There are cases where the body might produce sperm, but it's only retrievable through an operation, and it's a 60% chance that they will be able to extract sperm and you'll be able to father a child. Through various moments of sadness and depression, we decided to part company, and I decided to go off and discover myself as somebody living with Klinefelter syndrome. You know, I was growing up, I kind of thought I was a little bit different to the other kids. They were all going through puberty, I wasn't going through puberty. I was teased a lot about not having hairy legs and hairs on my body.
Not shown in this video is Dan giving himself testosterone injections. He has to take these daily, rendering this condition not only to be a physical and emotional one, but also one with an economical cost, as a single testosterone injection can even be $80, putting a strain on the whole family.
Here is Pauline's story of being pregnant with a Klinefelter's child. I'm 16 weeks pregnant and just found out that my baby has Klinefelter syndrome. My husband and I are going through a very difficult time. We are trying to weigh all the pros and cons about this syndrome and wonder if we should keep the baby. We know the symptoms can vary and some are more severe than others. We just got married in February and this is our first pregnancy. The doctor said this is purely random and not hereditary. Most likely our next one will be perfectly healthy.
Pauline shows another side, the social side. She and her husband are worried of what people will think if they have a child with Klinefelters. They know that their son will be different, and people will probably treat him differently, just because of an extra letter on his genetic makeup. Linda's story is about having a brother who secretly suffered from this disorder. My brother has passed away, and his death certificate stated that it was a massive seizure, and he had Klinefelter syndrome. My brother died at age 50 years, and no one knew he had the syndrome. He and my family struggled through life, and my brother had a very sad and confusing life. We did all we could to support him. Now I have just looked at the symptoms, and it explains my brother so well. My family is confused as his diagnosis as a child was learning difficulties, and they got no support. Life may have been so much easier for him if he was diagnosed with KS. My new worry is that I have a son who has been diagnosed with autism dyspraxia, but I have always thought he had something else. Now reading the symptoms of KS, my son has so many of the symptoms. My son has so many difficulties like my brother, especially as he gets older. He is now 13 years of age. I suppose my next step is to get my son tested for KS and take it from there. And finally, here's Liz Thompson's story of having a young son with Klinefelters. I am a mother of 3 and my only son has the syndrome. He is 8 years old, turning 9 in June. I have found this disability with my son to be quite challenging, especially his behavior and mood swings. His speech is good now, and I must say he is almost taller than me. And I would like to meet moms and dads out there that are going through the same.
Although there are many harsh symptoms that affect Klinefelter syndrome victims, as well as many negative aspects of the syndrome that affect family members and friends, there are also the happy moments in a victim's life when they begin to enjoy it, like everyone else, when their treatment begins to work, or when they are surrounded and supported by friends and family. These moments are the ones that we need to cherish and the ones we all need to remember in the future.
Thank you for your time.